And infectious disease specialist Dr. Todd Ellerin joins me now for more on this. Dr. Ellerin, the U.S. set records for new cases in the last 3 days in a row. So is the virus spreading because precautions aren't working or because people aren't following them?
Good morning, Diane. You know, the issue is we know the right precautions, but obviously we're uneven and it's not working since the trajectory is going the wrong direction. We have to think about where most of the cases are occurring in the U.S. And right now, the majority are within our homes. We're used to masking in public now, although that can be uneven depending on what state you're from. But we have to take advantage of knowing where this virus is. So when we come back home, if we have people coming in, if we have kids that are going to school coming back, we have to be careful and we have to make tough decisions, just like we heard the mayor say before. And masking in the home, opening those windows, being apart from the closest people that we love are some of the steps we're going to have to take.
State and local officials are implementing new restrictions. Here in New York, for example, bars and restaurants now have to close at 10 p.m. and gatherings in private homes are limited to 10 people. How are those limits? How effective are they?
So Massachusetts is doing the same as New York. These are very critical measures that are being taken, but what we don't know is, are they enough? This COVID-19 jet has taken off and taken off with a vengeance. It's unclear whether this is going to be enough or whether we're going to have to do more to get this virus under control.
Can you explain the time thing to me, though? We talked to the mayor of Jersey City yesterday, and he said, you know, coronavirus doesn't go to bed after 10 p.m. So why would limiting the amount of time that restaurants, for example, can be open make a difference?
Well, you know, again, I think part of it has to do with the informal social gatherings and the get-togethers. And we do know that this virus likes indoor transmission. So we just heard some studies about more cases occurring in restaurants and gyms and other places where people are congregating. So I think the hope is what we're trying to do, of course, is balance lives with livelihoods. And so by making a shelter-in-place guidance between the hours of 10 p.m. and 5 a.m., you know, the hope is that that's enough to get this under control, but that remains unclear.
Yeah, we know all these decisions are really difficult to make for anybody in charge, but field hospitals and overflow tents are popping up as hospitals are overwhelmed in several states. We heard the mayor of Duluth just saying she worries that may be coming soon for them. How does that affect quality of care when you get to that point?
Right. I mean, this is really concerning. You're really seeing a military triage. I mean, across the country, we're hearing about field hospitals being popped up. We're hearing about mobile morgues in certain states, you know, the stay-at-home guidance, the curfews. We're doing things that we have to do. These are extraordinary efforts. What I will say, though, about these field hospitals is that as long as we have smart, experienced people who are dedicated to patients managing this, and then you give them the right equipment, our patients are in good hands. Now, remember, with field hospitals, sometimes they're not utilized, especially the ones that were only dedicated to non-COVID-19 patients. So not all field hospitals are set up the same way.
And in the beginning of the pandemic, we saw Navy medical ships step in to provide support in New York and LA when they were hotspots. How do you offer that kind of support when hospitalizations are rising in every region?
It's a great point. I mean, this is really sobering, the number of cases. I mean, I had a dream that we were going to be having 200,000 cases and 2,000 deaths a day, and I'm afraid that that's going to be a reality sooner than later. But remember something, have faith that when you have a talented team, for instance, take Doctors Without Borders, that international independent relief organization. They go to the most challenging places in the world, and right now, they have come to the United States. And by the way, they're not just there for this wave. They were here for the first wave as well. So as long as we have people dedicated to taking care of patients, I think we are going to get through this, but it's going to be a rough patch for a while.
Yeah, I know here in New York, when we were the hot spot, we saw doctors and medical professionals coming in from all over the country and in some cases the world. So that is the one bright spot in all of this, is when you see the power of people coming together in all of this. If I could keep you for a few more minutes, I just want to hit you up with a couple of viewer questions, because I again invited them on Twitter to post on my Twitter page if they had questions, and I saw two that stuck out to me. One is from Ashley asking about the safety of hugging outside. If you're both wearing a mask and you're outside, can you give someone a hug?
Okay, so I think you can, but you have to individualize it. If you're the most vulnerable risk group, you may want to just sit out that. And I know that's so difficult because, you know, especially with our parents and grandparents, the elderly, we haven't been hugging them enough. So we have to be careful. But I like that you said outdoors. And I want to say one other thing, Diane. I don't think the hug is the most dangerous part of this. It's what you do before the hug and what you do after the hug. So if you're within that 6-foot radius, if you take your mask off, if you are talking or talking in a loud voice, those are more dangerous than an instantaneous hug. So, you know, think about that.
It's a great point, because some of us, we avoid the hug, but then you carry on in conversation around the table as if that part's okay, right? The other question was about the season. What is it about winter that makes it so dangerous when it comes to the virus? Is it just people getting together indoors, or is there something more to it?
There's a bunch of things, Diane, and it's a great question, because remember in 1918, the Great Influenza, it was the second wave, that winter wave, that really was the most deadly. A lot of it does have to do with being indoors, crowded indoors. This virus loves indoor transmission, where the ventilation is not as good as being outdoors. You know, when you look at outdoor outbreaks, they're few and far between. It's not to say you can't have a cluster, but the major super spreading events have been indoors. Also, this virus likes dry, cold air. Think about the hockey arena. That's why hockey has been one of the sports where we've seen clusters. So, you know, when the air lacks humidity, then it's easier for the virus to spread. And also, in the winter months, our mucosa, when you go to the back of the nose and the throat, it's drier. So our cilia, the things that bat away infections, don't work quite as well.
All right, Dr. Todd Ellerin, we appreciate you letting us pester you with all of our questions this morning and every morning you do it. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.